Good morning. This is Dr. Bella Kaiser from Skokie Institute of Allied Health and Technology. This is the month of March, and in addition to National Nutrition Month, which was a webinar that was um, recorded and presented to you last week, March is also National Billers Day. Even though the day stands out in the month of March, which is March 28th, but we want to honor them and we want to talk about what medical billers are and what is their job and their position. This is a short webinar that will focus solely on medical billers and their position, and also how we as an institution are connected to National Billers Day. So SIAHT, so just an introduction about us. We are Skokie Institute of Allied Health and Technology. We're a nonprofit or education organization. Our main and sole purpose is to provide the community with hands-on training and education leading to economic independence and entry-level positions. We are an online institution. So therefore, when we say online institution, we stand out among other online institutions as we are student-centered and community-centered. Another thing that makes us stand out is that we are affordable and flexible, and we value our students and their career and their training more than anything. We are currently enrolling for the spring term. Our winter two term that started on February 25th has already started. Now you can still enroll in any of our programs at a very affordable and flexible tuition plan and free and fees. And if you are a WIOA applicant or WIOA prospect, you can actually enroll for free. You can register for our programs, receive a free tablet, and then also save on tuitions. You will see that our tuition rates are very, very affordable compared to other online institutions and other institutions that operate. You can visit our website at SIAHT.org, and then we provide with online career training programs that are at the flexibility of your time, your schedule, with one-on-one instructor training also along with an LMS. Why do we stand out? Well, we are licensed by the Village of Glenview Business Office as well as Illinois Board of Higher Education to provide with career training programs. We are student-centered and community-centered, like I mentioned before. We provide with many free webinars that educate our community and our students. You can watch these webinars. These are very short, like probably 15 minutes the most. You can watch them on our YouTube channel. Then we have also been awarded the best higher education institution for 2 years. And we are in the Business Hall of Fame in Glenview Award Program. Now, why celebrate National Billers Month? Well, first of all, as changes are coming forth, the medical industry is experiencing a high demand for individuals who know medical office operations, transcription, billing, and coding. These are the skills that stand out. With the changes in ICD from ICD 9 to ICD 10, then in the Healthcare Affordable Act, we all know that billers can be an asset to a hospital, a medical office, an organization. The business office of every healthcare provider must submit proper documentation to a number of insurance companies and federal agencies for reimbursement in order to be successfully succeed as financially and avoid fraud charges. Um, this is where medical billers come in. They are aware of what proper documentation the medical office should submit and how to prevent fraud charges, and also how to prevent from wrong issuance of services to the insurance company. Because if the insurance company finds out that the diagnosis um, and the procedure was documented incorrectly, they can actually end up fining the medical office or the physicians. So we celebrate this day to honor those who help the doctors, hospitals, and offices to get paid for their services and make sure that patients are receiving the care they need based on their insurances. So what do medical billers do? They manage the processes, and and submit healthcare insurance claims to private health insurance. That also includes government insurances as Medicare and Medicaid. They're required to make sure that patients are billed in a timely manner and that healthcare providers are paid correctly for their services. These professionals also help ensure that insurance companies pay their share of the bill. So, in other words, they also make sure if this is something that a copay should cover, the charges should be covered by copay, and if there's something that should be covered by the insurance company, they they bill the insurance company and they make sure by providing the proper documentation that it will be covered. Medical billers also undertake a different part of healthcare process. They work within the billing departments of healthcare facilities and businesses, and they send bills to patients and make sure that patients and reimbursements are processed on time. So, in other words, if there's a patient with a question regarding their bill, this is where the medical biller will be able to help them. Because a lot of times patients have a lot of questions about why they have to pay set amount of fee, or they were expecting a bill, they were only expecting to pay a co-payment or a co-insurance, and now they have to pay over $100 deductible. What is that? Where is it coming from? All of this can be explained by the medical billers. Even though medical billers do not have direct patient communication, face-to-face interaction, they do communicate with patients indirectly, and that is through emails, through phone calls, when there are questions that come in a patient's mind regarding their bill. Now, what do medical coders do? So we mentioned medical billing and coding. Even though it's National Billers Day, we do honor coders also have similar job responsibilities. So a medical biller and coder will have generally the same sort of duties no matter what type of facility they're employed in. From clinics to hospitals to physician offices, medical billers and coders use medical codes to document patient diagnoses and treatments. Specifically, their duties include reading and analyzing patient records, determining the correct codes for patient records, using codes to bill insurance providers, interacting with physicians and assistants to ensure accuracy, excuse me, keeping in a track of patients' data over multiple visits, manage detailed, specifically coded information, and maintaining patient confidentiality information and security. So, what is our relationship to SIAHT? Why are we talking about it? Well, because we have programs in fitness trainer, nutrition and wellness coach, and also allied health. One of our allied health program includes medical billing and insurance specialist. Our program is 10 months long. We prepare the students in the program about ICD-10, coding guidelines. Students learn about medical terminology as well as anatomy and healthcare reimbursement along with coding with ICT and CPT as well as HCPCS. Students are required to complete an online internship that helps students prepare for the certification exam. Once the students graduate, they are eligible to sit for AHIMA, either CCS or CCA exam, or NCICS credential from NCCT. So a view about our website. Our website has all the information a student needs and can contact us at admin@siaht.org. You can also call us at 847-461-3985. You can also visit us in person by making an appointment. We have contact forms on our website that can be used to request an appointment. We are also on social media. So follow us on Facebook, Twitter, YouTube, Instagram, and LinkedIn. We're also on Google Business. Like us and get all our updates and notification for Health Awareness Months. You can find the links on our website. I hope you guys enjoyed this short webinar regarding medical billers. I really hope anyone interested out there in the program and to create a career um, and be an inspiration to their families and friends can contact us. We will help you get the career that you need. If you are a WIOA, which is Workforce Investment Occupational Act prospect, our programs are covered and you will not need to pay anything. Tuition will cover their grant will cover everything. Um, we'll see you next month with another update on another health awareness month. Until then, goodbye.